Psychotherapy is one way to treat psychological disorders. The other, often used with most serious disorders, is biomedical therapy, which changes the brain's chemistry with drugs or affects the brain's circuitry with electrical stimulation, magnetic impulses, or psychosurgery. Primary care providers prescribe most drugs for anxiety and depression, followed by psychiatrists and even in some states, psychologists. Today we're going to be talking about biomedical therapies. And so hopefully in the course of this small lesson, you will learn the following. What are the drug therapies? How do double-blind studies help researchers evaluate a drug's effectiveness? How are brain stimulation and psychosurgery used in treating specific disorders? And how, by adopting a healthier lifestyle, might people find some relief from depression? By far, the most widely used biomedical treatments today are the drug therapies. Since the 1950s, drug researchers have written a new chapter in the treatment of people with severe disorders. Almost any new treatment, including drug treatment, is greeted by an initial wave of enthusiasm, as many people apparently approve. But sometimes that enthusiasm often diminishes on closer examination. Okay, so how do we know if the drug is effective? To judge the effectiveness of a new treatment, we also need to know more. Do untreated people also improve? If so, how many and how quickly? Was recovery due to the drug or to a placebo effect? And this is when a patient's and or mental health workers expect positive results, they may see what they expect, not what really happens. That's the placebo effect. So, to control these influences when testing a new drug, researchers give half the patients the drug and the other half a similar appearing placebo. Because neither the staff nor the patients know who gets which, it is called a double-blind technique. Okay, so the researchers give half the patients the drug, the other half the placebo, but neither the staff nor the patients know who gets which, and that's why it's called the double-blind procedure or technique. The good news in double-blind studies is several types of drugs have proven useful treating psychological disorders. So the first kind of drug we're going to be talking about is antipsychotic drugs. So antipsychotic drugs, they reduce patients' overreactions to irrelevant stimulus. So how do antipsychotic drugs work? Well, they mimic certain neurotransmitters. Some block the activity of dopamine by occupying its receptor sites. And this finding reinforces the idea that an overactive dopamine system contributes to schizophrenia. Further support for this idea comes from a side effect of another drug. L-Dopa is a drug sometimes given to people with Parkinson's disease to boost their production of dopamine, which is too low in Parkinson's. L-Dopa raises the dopamine levels, but can you guess its occasional side effects? You guessed it. Hallucinations are the occasional side effects. So, antipsychotics combined with life skills programs and family support have really given a new hope to many people with schizophrenia. There are hundreds and thousands of people have left the wards of mental hospitals and returned to work and to live near normal lives due to drugs like those antipsychotic drugs that we've talked about. So these antipsychotic drugs they work by mimicking neurotransmitters and blocking neurotransmitters. Like alcohol, anti-anxiety drugs such as Xanax or Ativan depress central nervous system activity, and so should not be used in combination with alcohol. These drugs are often used in combination with psychological therapy to treat anxiety disorders, obsessive-compulsive disorder, and post-traumatic stress disorder as well. They calm anxiety as the person learns to cope with frightening situations and fear-triggering stimuli. So some critics fear that anti-anxiety drugs may reduce symptoms without really resolving the underlying problems, especially when used as an ongoing treatment. popping Xanax at the first sign of tension can provide immediate relief, which may reinforce a person's tendency to use drugs when anxious. Regular heavy use can also lead, when a person stops taking the drugs, to physical problems such as an increased anxiety and insomnia. So antidepressant drugs were named for their ability to lift people up from a state of depression. These drugs are now also used to treat anxiety disorders, obsessive-compulsive disorder, and post-traumatic stress disorder. They work by increasing the availability of norepinephrine and serotonin. These neurotransmitters elevate arousal and mood and are scarce when a person experiences feelings of depression and anxiety. So, a lot of people use a drug called fluoxetine, which tens of millions of users worldwide have known as Prozac. This lifts the spirits by prolonging the time serotonin molecules remain in the brain synapses. So it does this by partially blocking the normal reuptake process. Prozac and its cousin Zoloft and Praxil are often called selective serotonin reuptake inhibitors because they slow or inhibit the synaptic vacuuming up or reuptake of serotonin. It allows the serotonin to move along and to try to move along in the system. In addition to antipsychotic, anxiety, and antidepressant drugs, psychiatrists have mood-stabilizing drugs in their arsenal. So some of them, we have one that was originally used to treat epilepsy, was also found effective in controlling manic episodes associated with bipolar disorder. Another, the simple salt lithium, actually effectively levels the emotional highs and lows of this disorder. Australian physician John Cade discovered this in the 1940s when he administered lithium to a patient with severe mania, and the patient became perfectly well in less than a week. Although we don't understand why lithium works, about 7 in 10 people with bipolar disorder benefit from a long-term daily dose of this really cheap salt. Their risk of suicide is but 1/6 of that of patients with bipolar disorder not taking lithium. Okay, so let's move on to the brain stimulation therapy. Okay, so another biomedical treatment is electroconvulsive therapy, or ECT. So ECT manipulates the brain by shocking it. When the ECT was first introduced in 1938, the wide-awake patient was strapped to a table and jolted with roughly 100 volts of electricity to the brain. The procedure, which produced racking convulsions and brief unconsciousness, gained a barbaric image. Although that image lingers, ECTs have changed. Today, patients receive a general anesthetic and muscle relaxant to prevent convulsions. A psychiatrist then delivers to the patient's brain 30 to 60 seconds of electric current in a briefer pulses, almost sometimes only to the brain's right side. Within 30 minutes, the patient awakens and remembers nothing of the treatment or of the procedure preceding hours. So, would you agree that ECT for yourself or for a loved one? The decision might be difficult, but the treatment works. Shocking as it may seem, study after study confirms that electroconvulsive therapy can effectively treat severe depression in patients who have not responded to drug therapy. After 3 such sessions each week for 2 to 4 weeks, 80% or more of those receiving electroconvulsive therapy improve markedly. They show some memory loss for treatment period, but no apparent brain damage. Modern ECT causes less memory disruption than the earlier versions did. Okay, so another brain stimulation therapy we have is called repetitive transcranial magnetic stimulation. So in this, depressed moods often seem to improve when repeated pulses of magnetic energy are applied to a person's brain in a painless procedure called repetitive transcranial magnetic stimulation. A coiled wire is held close to the skull and sends a magnetic field to the brain. Unlike deep brain stimulation, the magnetic energy penetrates only the brain surface. So initial studies have found modest positive effects of repetitive transcranial magnetic stimulation. In one study, a woman with bipolar disorder benefited more from this than electroconvulsive therapy. How it works is not yet clear. One possible explanation is that the stimulation energizes the brain's left frontal lobe, which is relatively inactive during depression. The next biomedical therapy that we'll be talking about is psychosurgery. Psychosurgery is a surgery that removes or destroys brain tissue in an attempt to change thoughts and behaviors. Because its effects are irreversible, it's the least used biomedical therapy. In the 1930s, Portuguese physician Egas Moniz developed what would become the best-known psychosurgical operation, which is the lobotomy. So, lobotomy, he used, and later other neurosurgeons used this to calm uncontrollably emotional and violent patients. His crude but easy and inexpensive procedure took only about 10 minutes. So, a lobotomy is a psychosurgical procedure that was once used to calm uncontrollably emotional or violent patients. So, what they did is they cut the nerves connecting the frontal lobes to the emotion-controlling centers of the inner brain. So this picture right here is a picture of a young woman named Rosemary Kennedy. So she just so happens to be the sister of JFK, or John Fitzgerald Kennedy, one of our presidents of the United States. So on the advice of a medical physician, her father approved her getting this procedure, this lobotomy. Okay, and so supposedly they promised that it would control her reportedly violent mood swings that she was having. Unfortunately, the procedure left her confined to a hospital with an infantile mentality until her death in 2005, in which she was the age of 85 years old. So this is not a surgery that is used. It's very, very rare. This is not something we do anymore. And that's because this is something that you cannot change. It is a permanent procedure. And this is one where they cut the nerves connecting the frontal lobes to the emotion controlling center of the brain. So there are tens of thousands of severely disturbed people that have received lobotomies between 1936 and 1954. By that time, some 35,000 people had been lobotomized in the United States alone. For his work, Moniz received a Nobel Prize, but today lobotomies are history. Their intention was simply to disconnect emotion from thought, and indeed they really did usually decrease the misery or the tension, but their effect was often more drastic, leaving people permanently listless, immature, or uncreative. During the 1950s, when calming drugs became available, psychosurgery was largely abandoned. Today, more precise microscopic or micropsychosurgeries have been used in extreme cases. So for years, we have considered the health of our body and mind separately. That neat separation no longer seems valid. Stress affects body chemistry and health, and chemical imbalances, whatever their cause, can produce psychological disorders. That lesson is now being applied in training seminars promoting therapeutic lifestyle change. Two basic ideas behind these sessions are that human brains and bodies are designed for physical activity and social engagement, and that our ancestors hunted, gathered, and built in groups with little evidence of disabling depression. So those whose ways of life include regular physical activity, strong community ties, sunlight exposure, and plenty of sleep rarely experience major depression. So, lifestyle changes that enhance our health, these are really important for us to try to learn. Researchers show that regular aerobic exercise rivals the healing power of antidepressant drugs, and a complete night's sleep boosts mood and energy. In the lifestyle changes sessions, small groups of people with depression undergo a 12-week training program, and they have these goals that we're going to talk about. And these actually have been things that they have proven actually help with our mental health if we will apply them to our lives. We first have aerobic exercise, 30 minutes a day at least 3 times weekly. Increased fitness and vitality stimulates endorphins. And these are feel-good, help reduce pain, neurotransmitters in our body. Adequate sleep. With a goal of 7 to 8 hours a night, this increases energy and alertness, and it actually boosts immunity as well. Light exposure, at least 30 minutes each morning with a light box. This is what they have done with some depressed patients. It amplifies arousal and influences our hormones. Social connection. With less alone time and at least 2 meaningful social engagements weekly, this helps satisfy the human need to belong. Anti-rumination. By identifying and redirecting negative thoughts, this enhances positive thinking. So we need to change our thoughts, redirect them in a positive way. And then also we have nutritional supplements, including a daily fish oil supplement with omega-3 fatty acids. This aids in healthy brain functioning.